Hi, Kiran. Thanks so much for joining me to talk about your experience in the chiropractic program at the University of Western States. As a student ambassador, we appreciate you sharing this information with prospective students. So to get started, can you tell us what you like most about the program at UWS?
Yeah, I think what I like most about the program so far has been just the community feel of the program. So we have about 52-ish students in our cohort, and it's really like a family. Like everyone has gotten so close. I think that we get a lot of interaction with TAs, the professors. So I really just like that community feel. You definitely um, see familiar faces everywhere you go on campus. So I think that's the best part for me.
Great. And
Mhm.
I know that for every student this will be a little bit different, but can you kind of walk us through what a typical day looks like as a student? And I realize that also changes by quarter as well.
Yeah, so schedule definitely changes by quarter, but I think a typical day, so the first classes in the morning would start at 7:30, and then you could possibly have a last class until 5:30. However, we do have breaks in between. Sometimes you don't go the full time, and then every quarter you kind of have a different schedule. But we have a mixture of usually labs and lectures throughout the day. And then we do have a common lunch hour from 12:30 to 1:30. During that time, there's lots of clubs, meetings, and different things you can attend or just hang out for an hour. And so after a school day, during the weekdays, usually um, I would put in a few hours of work at home as well in the evening. But I do get time to still go to the gym. I get to make a fresh meal for myself in the evening. Um, so that's kind of a typical day on a weekday at least.
So during those days, do you participate in any club activities or have you done any club events?
Yeah, so I try to do a clubs maybe on 2 to 3 days of the week, and then take a few days off. But I do like to attend the adjustment club. That has been a great one. When we started learning adjusting, we had a couple labs a week, but it's nice to get instruction from the different TAs and from upper quarter students to see how they kind of teach things a little bit different, and just work on your skills because if it's a new skill that we're learning, and so we do have to hone it and get in as many hours as we can to be as good as we possibly can be. So that's been a good one. It's been helpful. And then I have a couple, like I've attended yoga club a couple times. That one's been fun if I just need like a mental break. So yeah, there's definitely a lot of cool clubs to check out. But those are the two that I have been to.
Have you done any of the ASB sponsored events? I know that they have like socials every year.
I have been. I went to the summer barbecue last summer. That was a lot of fun. They did put together a great event. They had the professors there, and like I said, it's such a community feel that it's a great time every time.
Oh, was that the one that DJ Dr. Partner was at? I
That's
think
the
so.
one. Yeah, that was
And
fun.
I believe that they had like a cotton candy machine and Hawaiian food.
Yeah, and
Yeah,
then
it
we
was pretty
also had
delicious.
like a volleyball tournament going on. That was a really good one.
Yeah, and there were all sorts of different athletic challenges. I forget all of them, but
Yes.
that was pretty awesome.
Yeah.
Yeah, so getting to know students in all sorts of different experiences probably helps you kind of relate to the upper quarter students and learn more about the program in general before you even get there.
Yeah, exactly. And then even with clubs, that's like one of the great benefits is meeting people from different quarters. And then you get to kind of ask them questions about clinic or just what to expect going forward into the program, any suggestions and tips. It's nice that everyone is always really helpful at the school. So yeah, it's really nice.
So I forget which quarter are you in right now?
I'm in sixth quarter, so
Sixth
about
quarter.
halfway there.
Halfway there. And so far, what's been the most challenging quarter for you?
I think actually this one, a lot of it is because of the online structure, however. So I think it's been a little bit challenging just with the transition. And also because we are done with the basic science courses. So this quarter we kind of started up with a lot more labs and a lot more case-based learning versus just learning factual-based recall. So we have a lot more practical courses a lot more analysis and things like that. So it's been a little bit more tricky this quarter.
Yeah, I can
Hmm.
imagine. It's
Yeah.
hard when you actually have to start doing the critical thinking and assessing rather than just simply memorizing things and repeating them back.
Exactly. Yeah.
Let's see. So I had a few more questions for you. I was wondering,
Sure.
I think you mentioned at one point that you knew someone at UWS before you started. Can you
Yeah.
tell me
So
a little more about that?
yeah, I can. So the two people that I knew were two doctors, alumni from the program. I actually shadowed them back home while I was in undergrad. So I started shadowing them pretty early, and it was a great experience. They taught me a lot about kind of the chiropractor that I wanted to be, what UWS teaches and enforces, and the kind of chiropractor that they would like you to be at the end of the program. So it was kind of nice seeing where I would be at the end of the program, just looking at them. And they were also not recent grads, but what they were definitely like just like 5 years out
Mhm.
from graduation. So that was really nice. And they told me a lot about the program and answered any questions I would have. So I would highly recommend um, if there is a UWS alumni in your area, I would highly recommend shadowing them.
And would you recommend that prospective students shadow more than one, or like chiropractors with different perspectives or different specializations?
I think so for sure. I think the best way to know what kind of doctor that you want to be is by shadowing as many different people as you can. Even if it's not different perspectives and doctors, if you already know you want the evidence based, rehab based, whatever it is that you would like, it's still nice seeing how the office is run, getting kind of a clinic atmosphere and just little tips and tricks. Every doctor will teach you something different. So I think there's so much to take away from shadowing as many people as you can.
That's a really good point. I've even heard from some people that they've shadowed doctors that they never wanted to emulate, and that as well was a good experience for them to realize, like, okay, this is how I definitely don't want to practice. So
Exactly. Yeah, it teaches you a lot still.
awesome. So what do you envision for your future practice after shadowing people and now halfway through the program?
Yeah, I think so. I did work as a reception in the clinic with the UWS alumni that I shadowed. And I loved that practice a lot. They had a really nice setup where it was a multidisciplinary approach. They had RMTs, physios, kinesiologists on site as well. So I think it was that collaborated effect that I really loved. They had meetings every single week, and if they had common clients, they would common patients, they would discuss the cases together, see what one practitioner is doing, see what another is doing, and kind of collaborate their efforts. So I think that was great. And you can really see the benefits in patients that way. And it just showed how much they cared to put in the time to see how the whole treatment plan was going for the patients. So I think that's kind of a place where I want to be, where I have multiple different perspectives um, coming in all together in one clinic.
That makes a lot of sense. So
Mhm.
are you thinking then that as you go through your clinical rotations at UWS that you'll choose rotations that are similar?
I haven't quite thought about that one yet. Yeah, I think I would. And then I do want to get out and shadow just to places in Portland as well, see how the clinics are run here versus back home. But yeah, I think I would choose a clinic that had a few different practitioners in the one clinic.
Awesome. And so I'm curious, out of all of your coursework so far at UWS, is there a specific course that stood out to you that you've really loved more than the others?
Yeah, I think I liked, we took rehab principles in quarter 4, and it was just an intro into rehab. So we have a lot of them coming up still. But it was really nice to kind of get a feel for all the different work that we can do, such as we tried out some instrument assisted work. We did some pin and stretch and just a lot of cross fiber work, a lot of different stretching techniques. And I think those are things that I'll use every single day in my practice with every single appointment. So it was really nice to get like an intro into that.
Awesome. Which instruments did they go over in that class?
So they were Graston like, but not specifically the Graston brand, but
Mhm.
a lot of those kind of tools that we use to do some muscle work and things like that.
Awesome.
Hmm.
So the last question I have for you, what are the courses that you think were the best for preparing you for the program? And then which within the chiropractic program are the best for preparing you for future practice?
Okay. So I think preparing me for the program is for sure anatomy. I had been lucky to take a lot of anatomy in my undergrad, and it helped me out a lot. I think if you start with just the anatomy as an intro when you first get into the program, it'll be overwhelming. Um, and I think that it in 3 quarters you can learn a lot, which is what you'll get 3 quarters of anatomy. But to have like a really solid understanding of anatomy, it takes a long time. So I think just having um, that as prior knowledge would be a great benefit. Um, and then as for what would help me in clinic, um, I think spinal disorders has been a big one that I've taken right now. Um, just learning about all the different diagnoses and how to uh, basically create a diagnosis and what things you're going to rule out, what things you're going to rule in, how to do um, a proper history, and just yeah, I think that course has been the most fundamental.
That sounds like a foundational course for any
Yeah.
career. So before we say goodbye, do you have any tips for prospective students on adjusting to life in Portland, or how to get out and have a life separate from life on campus?
Yeah, I think Portland's an awesome place to be. It's so much fun. So it's definitely important to take some time out and enjoy it. The best part for me, or what's worked the best for me, is having a schedule. I make a schedule every single Sunday for the entire week about what I'm going to do every single day. And I make sure to get most of my work done during the weekdays. So Monday to Friday, I work hard, and I definitely have time then to give myself um, a little bit of a break over the weekend and go enjoy things. So I think that's been the most crucial as for setting time aside for yourself. Um, I think yeah, that would be my top tip.
Great. Thanks so much, Kiran. And if anyone has questions, feel free to email studentambassador@uws.edu, and Kiran will be happy to answer them that way too.
Yes, thank you.